Hello, future nurses. This is Professor Hale. I'll be covering epiglottitis in this video. This is in your Chapter 30, Child with Respiratory Condition. Okay. Epiglottitis happens when epiglottitis, which is a small cartilage, like a lid that covers the windpipe, and it swells. You get edema there. The swelling blocks the flow of the air into the lungs, and it can be deadly. So many factors that can cause epiglottitis to swell, and these factors include infections, burns from hot liquids, injuries to the throat. Epiglottitis can happen at any age. So once mainly the primary population is children. They're the ones that are more susceptible to it. And the common cause of epiglottitis in children was the infection with Haemophilus influenza, so which is type B, which is quote unquote Hib bacterium. And that bacterium causes pneumonia, meningitis, and blood infections. And edema, it really occurs rapidly. So once you notice the signs and symptoms of that, it's an emergent medical emergency. Routine Hib vaccinations for infants has made epiglottitis rare in children, but we're seeing more of a rise on that because a lot of the population now are opting out of vaccinating their children. Clinical presentation, the symptoms in children. So children can develop symptoms of epiglottitis within hours. And those symptoms are fever, sore throat. They have an unusual high-pitched sound when breathing in, and that is known as stridor. Difficulty and painful swallowing. They drool because they're unable to get back their secretions or swallow their secretions. They act anxious and irritable. They usually sitting up and leaning forward to ease the breathing, which is called the tripod position. And then the different symptoms in adults. Adults might get symptoms over days rather than hours. Symptoms might include an adult sore throat, fever, muffled or hoarse voice, unusual high-pitched sound or breathing in, and that's known as stridor as well. Difficulty breathing, difficulty swallowing, and drooling. So they have similar symptoms in epiglottitis. The only difference is between adult and a child. In child, it is more severe. Symptoms occur a lot quicker and more rapidly. And to diagnose epiglottitis, and before I get into that, risk factors. Some risk factors increase risk by getting epiglottitis. This includes having a weakened immune system. So an immune system weakened by an illness or medicines can be more likely to get the bacterial infections that may cause epiglottitis, or not being fully vaccinated. Skipping vaccines or not getting them on time can leave the child open to Haemophilus influenza, which is type B, and it can increase the risk of epiglottitis. So with that said, the diagnosis to determine if it's epiglottitis is a physical examination, the presentation of the child. You want to get a history of the symptoms when they occurred. Neck X-ray can give a really good visual of the epiglottitis and see how the severity of it and where the edema is in the neck, where you can see in that X-ray, and that's an actual X-ray of a child with epiglottitis. Blood gases, CBC to see if there's any infection, white blood count, visualization of the airway, and the only way to do that is in an operating room, and that's done by a surgeon. And then when you're assessing a patient, you never want to get a throat culture. You don't want to put a tongue blade to visualize the throat of the child who presents with symptoms of epiglottitis, because that can increase the inflammation process, so it can exacerbate those symptoms. Interventions are maintaining airway. Is pretty much airway. That is a huge thing with anything with respiratory. Take that in mind. The major priority is airway, and you're going to make sure you're going to manage that. How are they breathing? You're going to continuously assess their breathing pattern, the rate pattern. So we already discussed that, and I gave you some handouts on the normal respirations and adventitious breath sounds as well in respirations. So that's why it's always important to know your baseline and your normal values. Close monitoring of their breathing, establish IV access. Because you're gonna be giving most likely IV antibiotics, steroids to reduce the inflammation, antipyretics to reduce the fever. This picture on the right here with that person there with the epiglottitis, it's a perfect visual and explanation of care and management of epiglottitis, especially with the symptoms and the treatment. So that's a really good visual for you guys to take note on. Nursing considerations, you want to explain all procedures and treatments and lend emotional support to their guardians or families and to the patient. And it's important to keep the kid to child calm. You don't want to get them any upset, so you want to make sure that you don't scare them. Approach them accordingly as the age developmental stage as their age is. That is very important. Because when they cry and they get more emotional, that can also exacerbate their symptoms and the inflammation, and can close off their airway. You want to monitor the patient's airway and breathing very closely and treat as needed. Administer oxygen therapy, IV fluids and medications as prescribed, and monitor the side effects of such. Maintain a child on the pulse oximeter, so you want to continuously monitor their oxygen saturation. And here is the health promotion. It's basically vaccinating. And that will reduce the risk for epiglottitis in children. Hib vaccines are recommended for children at ages 2, 4, 6, 15, and 18 months. And as I said earlier, being fully vaccinated against the Hib significantly decreases the child's risk for acquiring epiglottitis.